Picture this, it's a busy day at the hospital. Patients are coming in non-stop, and nurses are rushing around, providing the best care possible. Suddenly, a team of untrained individuals walks in. Are they a blessing or a ticking time bomb? That's the million-dollar questions we are answering today. Hey there to my fellow nurses, my nursing students, and all you others out there. It is me, Martin, aka the Danish male nurse, a bachelor in the science of nursing and a clinical nurse educator based in the lovely town of Slagelse. Today we are diving into a topic that has stirred quite the debate in the healthcare community around the world. The role of the unskilled worker in supplementing trained care staff. Now, don't get me wrong, unskilled workers can be a fantastic addition to healthcare. They can take on numerous roles that free up the skilled staff like us nurses, so we can focus on the more specialized task. But, and this is a big but, it is absolutely crucial to strike a balanced approach to ensure we are not compromising on the quality of care. So if you ever wondered whether unskilled workers are boon or bane in healthcare settings, then stick around because we are about to dissect these complex issues and look at it from all the angles. But before we dive into today's topic, I want to point out that if you have any questions along the way, then I'll leave them in the comments and I'll answer them as quickly as possible. It might not be directly in the comments. I might make an entire video from your one comment. So any question you might have, write it down there. Now that we have set the stage, let's dive into why trained staff like nurses and medical practitioners are such an essential part of the healthcare system before we dive into how we can use unskilled workers to elevate the quality of care. First off, let's talk about specialized knowledge. As a bachelor in the science of nursing myself, I can tell you that the education and training we go through are rigorous. We learn everything from anatomy and physiology to complex care procedures and medication management. This specialized knowledge is vital because it enables us to make informed decisions quickly, especially in life or death situations. And just try to think about the last time you had to insert an IV, manage a ventilator, or administer medication. These tasks requires a precise skill set and a deep understanding of medical protocols. The slightest mistake can have severe consequences. Skilled staff undergo continuous training to ensure that they are up to date with the latest and best practices. There's a code of ethics, licensure requirements, and a well-defined scope of practice that governs what we can and cannot do. This level of accountability ensures a high standard of care and offers a safety net for patients. To give you an example, a study conducted by the American Journal of Medical Quality found that higher staffing levels of trained nurses were directly associated with better patient outcome, including lowering rates of patient mortalities. Let that just sink in for a moment. More trained staff literally means saving more lives. So, as we discuss supplementing care staff with unskilled workers, it's important to remember the irreplaceable role of the trained staff. They provide the backbone of medical expertise, procedural know-how, and ethical accountabilities that keeps the healthcare system running. And not just running smoothly and, most importantly, safely. And with that in mind, you might ask, what about unskilled workers? Can they really fit into this highly specialized environment? For that, you have to stick around as we explore this further. Now that we've delved into the invaluable role of the trained healthcare staff, let's shift our focus to the rising presence of unskilled workers in healthcare settings. It's a trend that's gaining momentum for several reasons. First up, budget constraints. Let's face it, healthcare isn't cheap. Hospitals and care facilities are often under enormous financial pressure, trying to provide top-notch care with limited resources. And it is here the unskilled workers enters. They are typically less expensive to hire and maintain, making them an attractive option for tasks that doesn't require specialized medical knowledge. But there's also another reason: staff shortages. We've all been there. Overworked, understaffed, and stretched thin. In many places, there simply aren't enough trained healthcare workers to meet the demand. Unskilled workers can step in to fill the gaps for non-clinical tasks such as transporting patients, housekeeping, and basic care like feeding and bathing. And we still haven't covered all our bases because, last but not least, there is an expanding patient load. With an aging population and increasing healthcare needs, the number of patients isn't going to go down anytime soon. Unskilled workers can help manage this growing patient volume by taking on roles that, while not medically complex, are absolutely necessary for the smooth hospital operations. So what roles does unskilled workers commonly take on? Well, it varies from facility to facility, but they often handle tasks like cleaning, food service, and basic patient assistance like helping with mobility. In some settings, they might also assist with non-invasive procedures under supervision. So we have to face the fact the rise of the unskilled workers in healthcare is not a fluke. It's a response to a very real challenge the industry faces. But as we welcome this new workforce, it is crucial to remember that they are a supplement to trained staff, not a replacement. Alright, so we covered why trained staff are crucial and why unskilled workers are on the rise. But what does this mean for the quality of care? Stay tuned as we delve into the potential benefits and risks of having unskilled workers. Now let's shed some light on the benefit that the unskilled worker brings to the table. First on the list is cost effectiveness. As we already discussed, healthcare isn't cheap. Employing unskilled workers for tasks that doesn't require specialized training can significantly cut down on cost. These savings can then be redirected towards other critical areas like research, better equipment, or further staff training. Next, let's talk about workloads. Nurses and other trained healthcare workers often find themselves juggling multiple responsibilities, from patient care to administrative tasks. Unskilled workers can ease this burden by taking on some of these responsibilities, such as cleaning, administration tasks, and basic patient care. This allows you as a trained member of staff to focus on what we do best, providing specialized medical care. Another one of those benefits is versatility. Unskilled workers can be employed in a variety of roles, whether it's housekeeping, food service, or basic patient assistance. The adaptability can be a significant asset in optimizing workflow. Some unskilled workers even undergo on-the-job training to assist in more complex tasks under the supervision of trained staff. To give you a real-world example, I remember a time when our hospital faced a severe staff shortage during flu season. Unskilled workers played a crucial role in helping us manage the situation. They assisted with tasks like transporting patients and stocking medical supplies, which allowed us in the nursing staff to focus on clinical care. And I will say their contribution was invaluable. Without them, well, the entire care staff would have gotten stressed. So as you can see, unskilled workers can bring various benefits to healthcare settings. They can be a cost-effective addition that not only eases the workload on the trained staff, but also adds versatility to the overall healthcare team. However, as with anything, there's always another side to the coin. While unskilled workers can be incredibly beneficial, there are also risks involved if not managed properly. So make sure that you stick around as we explore the potential pitfalls in the next segment. We have laid out the myriad of benefits that unskilled workers can bring to healthcare settings. But as the saying goes, there is no such thing as a free lunch. It is time that we delve into the risks and downsides that comes along with incorporating unskilled workers into the healthcare sector. First and foremost, the quality of care. While unskilled workers can handle a variety of non-specialized tasks, there's a clear line between what they can and cannot do. If that line gets blurred, it could compromise patient safety. Imagine an unskilled worker incorrectly administering medication or misunderstanding medical protocols. The result could be disastrous. And with such disastrous thoughts, let's talk about communication gaps. In a healthcare setting, effective communication is crucial. Trained and unskilled staff may not always speak the same medical language, which can lead to misunderstandings and, in worst case scenarios, mistakes that affect patient care. And I dare not say it, but it can end up costing lives. And with these dark thoughts in our heads, let's take another point worth mentioning, and it is the need for supervision. Unskilled workers often requires oversight from trained staff to ensure they are performing tasks correctly. While they can ease the workload, they can also add another layer of responsibility for skilled workers, because the unskilled worker needs to be supervised and corrected in their action as needed. Let me just share an example to drive this point home. In a care facility where I once worked, an unskilled worker was assigned to assist with meal preparation and feeding. Unfortunately, this unskilled worker weren't aware of the particular patient's dietary restrictions, in this case the consistency of the food. It had to be precise, otherwise the patient could choke on it. Thankfully, I know my patients, so I, as the trained nurse, caught this mistake in time, but it was a busy day. I could so easily have overlooked it. And if I had that, this could have been fatal for this patient. And for me, it serves as a cautionary tale of what can go wrong without proper oversight. So incorporating unskilled workers into healthcare is like walking a tightrope. On one side, you have the potential benefits of cost saving and workload reduction. On the other side, you have the risk that can jeopardize patient safety and quality of care. The key to success lies in the balance between these elements. So where does this leave us? Can we integrate unskilled workers without sacrificing the quality of healthcare? That's a big question. And let me try to answer it as precisely as I can, because it is a bit complex. Firstly, balance is key. As a bachelor in the science of nursing and a clinical nurse educator, I can't emphasize enough the importance of maintaining a balanced team of skilled and unskilled workers. Each brings unique skills and contributions to the table, and the synergy between the two can lead to a more efficient and effective healthcare setting. But we also have to consider responsibility and oversight. It is crucial for trained staff to provide proper guidance and supervision to the unskilled workers. This will not only ensure the quality of care, but also help unskilled workers grow and possibly move into the specialized role over time. Another takeaway that is needed is continuously evaluation. Healthcare institutions should regularly assess the impact of incorporating unskilled workers to ensure that patient safety and quality of care are not compromised. Metrics such as patient satisfaction, readmission rates, and clinical outcomes can offer valuable insights. So the incorporation of unskilled workers into the healthcare setting can offer several advantages, from cost saving to workload reduction for trained staff. However, this should be approached with caution and strategic planning. to migrate potential risks. It is not about choosing one over the other. It's about creating a cohesive team that can provide the best possible care for the patient. And if you want to know more about providing the best possible care for the patient in a holistic way, then check out this video on Kari Martinson's theory. It's a holistic way of viewing the patient, and I find it especially helpful in my daily practice.